The Adolescent Transitional Living Program is a 28-day program for kids ages 13 to 17 who need more time than the usual 5 to 7 days on an inpatient service to stabilize. We take kids who have typically been in distress, in crisis, and we take care of them. We take care of them and we take care of their families. So what does that mean? That means that we assess them really thoroughly and conduct a diagnostic inquiry, which includes neuropsychological, academic, clinical data, as well as behavioral data that we've seen on the unit. We involve outpatient providers and clinicians in a diagnostic meeting that helps us to understand what the problems have been for the patient. And we also do a very thorough assessment of parents and families. And that helps us to contextualize and understand our adolescents, because adolescents, unlike adults, live in an ecosystem. And their environment is sometimes a very important moderating factor in the illness or the problems that they've been experiencing. In addition, we teach our kids dialectical behavior therapy, which is a very nuanced and important set of coping skills that is also a language that our kids can use with their parents and in the community in order to help themselves stay safe. Safety is of paramount importance to us, and we have intensively trained staff from the top to the bottom who are taking care of our kids day in and day out, assessing them, monitoring them, looking after them, encouraging them to learn the skills that ultimately will serve them a lifetime. In addition to all this, we do intensive medication management and often with the help of genetic testing help to establish what kinds of medications might be helpful for what kinds of symptoms based on the diagnostic assessments. And in many cases, we wind up taking kids off medications that previously have been hard to take off, because outside of a transitional living setting, it can be scary to take kids off medications. And we're able, some percentage of the time, to get people on less medication, not more. And finally, we have a creative arts-based curriculum and program which embraces the total child, meaning we have visual arts, music, movement, tai chi, yoga. We have a published author who does a weekly creative expressive writing circle. We have a master West African drummer who comes on Fridays and plays with the kids. And we have an amazing relationship with the Silvermine Arts Guild up the street, where the kids go not for arts therapy, but for arts skills acquisition. And they learn how to be good artists, because we believe that creative expression is as important for many of our kids as some of the therapy that they receive. And the final piece is the intensity of the family program. For a lot of parents and kids in crisis, they have struggled communicating one with the other. And based on the DBT model, we provide an opportunity for parents and kids to really get to the bottom of some of the pervasive conflicts that have perpetuated some of the problems that have brought them to our attention. And we sort of get them to accept what has been going on and find new ways forward. And at the end of the day, the Adolescent Transitional Living Program is truly a safe place for kids and families, but mostly for teens. Life is increasingly nuanced and difficult for teens. And to have a space that's dedicated for them, for their well-being, physical, emotional, spiritual, is so important when they're facing a crisis. And it is our great pleasure to take care of them.